We're seeing more and more drugs, everywhere from heroin to marijuana that have some kind of traces of fentanyl laced in them.
I went to the bathroom and saw him laying face up, and his lips were blue, and I knew what it was.
Narcan is a huge resource to all of us, both for our coworkers, for the community.
For me personally, I just didn't want to feel anything anymore. I didn't feel like life was worth living. When I'm not taking care of my mental illness, I could fall back into my addiction, but if I'm not taking care of my addiction, I might fall back into my mental illness.
Even though the things I was doing was enough to kill me, but I was still fearful and I guess prideful to ask for that help. She listened, and she didn't judge. Not one time. She didn't judge. She listened to me thoroughly. She asked questions, and I don't know what she did. It was like magic.
That's usually what keeps people inside of these cycles, is they create habits and they can't get out. And Kenosha County Crisis forces you to get outside of that cycle you've created for yourself.
And I was sitting in the back, but not in the back seat, in the back where you put your feet, curled up like in a fetus position. And that was the time that says, this is it. I do belong to various organizations, like the Substance Abuse Coalition, the Alcohol Outreach Center.
In Kenosha County, there's a ton of resources. I liked and still like Smart Recovery. I will have 3 years clean from heroin on December 12th. And I couldn't have done it without some of the resources that are available to me right here in Kenosha. It's tough, but it's worth it.
The most important thing someone should know about the crisis line is that we are here to help.
Ask for help early and often, and be okay with asking for help.
Kenosha County Behavioral Health Services is really made up of 4 distinct areas: prevention, intervention, treatment, and recovery.
We cannot live in silence anymore, and we start with you.